With cases of whooping cough on the rise in some parts of the world, many parents might be wondering how they can protect their little one. This morning on Ask a Specialist, we'll talk about what you need to know with Dr. Barbora Kadeka, a pediatrician at Queens North Hawaii Primary Care Clinic. Aloha, doctor. Thank you for joining us this morning.
Thank you, Brittany, for having me.
Such an important topic, especially for the keiki. So many people right now, especially summer season, the babies are coming. All right, so I want to start off. What is whooping cough or pertussis, and how does it present itself?
Great question. So whooping cough is a vaccine-preventable disease. It can cause a respiratory infection. It is caused by a bacteria. And typically, in the first 1 or 2 weeks, it can actually look like a mild common cold. So runny nose, a little bit of cough, maybe a little bit of fever. But then compared to a normal cold, the cough doesn't get better, it gets worse. And it can have these long coughing fits that are typically exhausting and can be accompanied with the typical whoop.
Wow, and that's why it's called whooping cough. Great to know. Now, why is it so important to talk about whooping cough?
So another great question. So we've been seeing a lot of cases arising worldwide of whooping cough. But more importantly, we've been seeing a lot of recent cases in our communities too. On the Hawaii Islands, even the Big Island and Waimea where I practice, there have been confirmed cases.
Wow.
We know that whooping cough is not just a regular cough. It can actually have very serious and life-threatening complications, especially for the most vulnerable population, which we consider the kids that are under 1 year of age. And then, of course, someone with more critical conditions, chronic conditions like asthma patients.
Right, so the older generation, and then, of course, the younger kids who might not have built up an immune system yet.
Yes.
Great to know. Now, what can parents do to help protect their child from whooping cough?
So, as mentioned, it's a vaccine-preventable disease. So, ideally, you want to vaccinate your children, but also think about your household. Typically, the first DTaP vaccines that does combine the pertussis vaccination in there. The first one is given at 2 months of age. You do need multiple doses to acquire the full immunity, but the prevention can start in utero too. So for all of the expecting moms, we do recommend getting the Tdap vaccine during pregnancy. And then think about your household members too that will be in contact with the baby so that they can get a Tdap booster. I think lastly, what is also important to know, in addition to vaccination, if you're worried that you were in contact with someone that had pertussis, talk to your provider, as there might be a choice to do what we call post-exposure prophylaxis, where a provider can give you antibiotics to limit the spread of the disease and also the complications of the disease.
Wonderful. And doctor, you're an expecting mom too, so this is really important information, even now, of course, not only for keiki, but for expecting moms, and of course, like we were saying, the older generation whose immune system might not be up to par to what it was in recent or previous years, rather. Great information. Thank you. To learn more about the services provided by Queens Pediatrics Department, you can visit queens.org, click on Services, then click on Pediatrics. Thank you, doctor, for joining us this morning. Again, we'll have all of this information on KHON2.com so that the viewers can find it and then rewatch the interview.
Thank you, Brittany.
Aloha. Thank you.